On fludrocortisone. Disclaimer: this presentation was made by an Addison's disease patient and is not intended to diagnose or treat any medical condition. Consult your healthcare practitioner before starting or stopping any medical treatment. I am not a doctor, nor do I claim to be. I am simply an adrenal insufficient woman who has done much research to understand adrenal disease and seeks to help others understand as well. Florinef, fludrocortisone. Medication used as partial replacement therapy for adrenocortical insufficiency and for the treatment of salt-losing adrenogenital syndrome. May also be used for the treatment of POTS syndrome. What is fludrocortisone? A potent mineralocorticoid medication used to replace aldosterone in adrenal insufficiency and salt-wasting syndromes. Explanations. Mineralocorticoids are a class of corticosteroids, which are a class of steroid hormones. Mineralocorticoids are produced in the adrenal cortex and influence salt and water balances. The primary mineralocorticoid is aldosterone. What is aldosterone? Aldosterone affects the body's ability to regulate blood pressure. It sends the signals to the kidneys to regulate the amount of sodium the body sends into the bloodstream or the amount of potassium released in the urine. It causes the bloodstream to reabsorb water with the sodium to increase blood volume. Aldosterone also helps maintain the body's pH and electrolyte levels in the blood. Understanding aldosterone. Aldosterone is closely linked to two other hormones, renin and angiotensin, which create the renin-angiotensin-aldosterone system. This system is essential in regulating proper blood pressure and electrolyte balance in the body. What is renin? Renin is an enzyme secreted by the kidney that is part of the psychological system that regulates blood pressure. In the blood, renin acts on a protein known as angiotensinogen, resulting in the release of angiotensin 1. Angiotensin, a group of hormones that are part of the renin-angiotensin system. To create angiotensin, the liver creates a protein called angiotensinogen. This protein is broken up by renin, which comes from the kidney. This forms angiotensin 1. Angiotensin 1 passes through the bloodstream where it turns into angiotensin 2, which is the primary form of the hormone that affects blood pressure and other areas of the body. Explanations. Simply put, proper aldosterone levels are essential to the synergy of chemicals in the body. In adrenal insufficient patients, fludrocortisone is used to synthetically balance electrolytes and blood pressure levels. Dosing. With any other steroid medication, general recommendations are to start out on the lowest possible dose according to blood renin levels and electrolyte levels determined through a metabolic panel lab result. Warnings. Fludrocortisone is a very potent medication and it directly affects cardiac function. Too high of a dose can lead to high blood pressure, stroke, swelling, weight gain, and mental disturbances. Please be vigilant of any changes your body is presenting and contact your doctor if you exhibit any of these issues. Sources. You can visit these websites for more information. Thank you for watching. My name is Winslow E. Dixon. I personally have adrenal insufficiency and have made this video to explain medications that I personally have to take. My personal warnings for this medication is I did have weight gain and high blood pressure issues when I was on too high of a dose. I currently take half a pill every day and do pretty well on it. Please be vigilant of all your symptoms and contact your physician if you have any issues. Thank you again for watching. You can visit my websites as listed below if you would like more information.